There is a partnership between Uganda Regional Hospital, the government of Sweden, and Busoga Forum, and this is for the Neonatal Project, which is looking at reducing the mortality and the suffering of the newborns. We know as a region, so the region have a high number of under-5 mortality, which the biggest contribution is the neonatal mortality. And through this collaboration, we have intervention put in place to reduce the neonatal mortality, neonatal mobility, and through this collaboration, we think that there will be reduction in mortality, reduction in mobility, and this will result into having a healthy population, and also having a healthy population. Through this collaboration, there is an exchange program. Health workers from Uganda Regional Hospital and Busoga Health Forum, they went to Sweden for a program for exposure. Then they came back, but also we had experts led by our senior consultant neonatologists, doctors, nurses, and midwives from Sweden who came to Uganda Regional Hospital and worked with our staff for about 2 weeks in the areas of neonatal care unit, labor suite, and maternity ward. And all this was to reach the gap between neonatal and maternity ward to reduce, so that you reduce that 1 minute rescue, so that you can rescue these babies. And through this collaboration, our staffs have learned skills, how to resuscitate, how to handle the newborn. Yeah? Given the fact that they got some new lessons learned from the exchange visit, and this exchange visit is ongoing. In November, another set of our staffs will also be going back to Sweden. 1 year from now, we see that we shall have many of our health workers who will be equipped with the knowledge and skills to handle neonates. And we see that from 1 year from now, we shall see that we will be decreasing mortality and mobility. And also, through this collaboration, there are also other future plans. We are looking forward to having also probably a fellowship in neonatology. As is a collaboration still between government of Sweden, the General Hospital, Busoga Forum, and Makerere University. And I think this will increase on the manpower and also open capacity building in the field of neonatology within the country.
My name is called Dr. Harriet Nyambuya. I'm a senior consultant pediatrician. I cover services in Uganda Regional Hospital. I work in the neonatal unit. And in my capacity as a pediatrician, I see patients, I build capacity by training junior doctors, both the interns, the postgraduate students, and the medical students who are in the training and at the University of Kampala International University. Thank you very much. As a country, we are grappling with how to reduce the neonatal mortality. So when this project came in as a collaboration between Busoga Health Forum and Uganda Regional Hospital, and a team of doctors, of health workers that included neonatologists and nurses working in the neonatal unit who came over to Uganda Regional Hospital, they have empowered our units, particularly in some of the practices on how to improve patient care in our unit. One, to highlight, we are trying to see how to improve infection prevention in regard to a neonate. So they have raised the key things regarding antimicrobial stewardship. They have shared with us the key importance of the role of a blood culture in caring for a baby who has suffered neonatal sepsis. And in doing this, we'll be able to reduce neonatal mortality in relation to neonatal sepsis. Secondly, we have received information regarding nutrition and care of these neonates, particularly the preterms. This is an area which has been grey and people have been struggling, but with this team being around, they have empowered us with information which is going to change a lot of practice in my neonatal unit. And going forward, it will be able to reduce mortality to things like hypoglycemia, which in our setup has been has been fought but not to success.
So my name is Agnes Linnér. I'm a neonatologist working as a consultant at the Karolinska University Hospital in Stockholm, and I'm also a researcher at the Karolinska Institute in Stockholm. So I've been here in Jinja at the hospital for 2 weeks now, looking at newborn care, because I'm involved in the Jinja Stockholm collaboration, where we work on improving newborn health together with colleagues here in Uganda. So the things that we've been working on these 2 weeks are the collaboration between the labor unit and the NICU, so basically the first hour in life for the newborn babies, because that's very important for future health and disease. Also, we've met the champions working with IPC, that is infection prevention and hygiene. We've looked at the nutrition of newborn babies, breastfeeding support, enteral and parenteral nutrition, and how to improve those things. So we're looking forward to continue the collaboration that we've started and that will go on for the next 3 years.
Hi, my name is Elena Palleri and I'm a consultant in neonatology at Karolinska University Hospital. I have a PhD in necrotizing enterocolitis, and I still do research on neonatal nutrition and necrotizing enterocolitis. We are here now in Jinja with a project from Pediatric Health Initiative, and it's a collaboration between our 2 hospitals and region and through Busoga Health Forum. What we have been doing in these 2 weeks that we've been here, we have worked mainly with training and education. We had morning lectures on hypoglycemia and fluid management in a newborn, the golden hour, and all the small stages that we need to take to improve neonatal care. I hope that we can implement a lot of the work that we have been discussing. We have been implementing some medical devices, like for measuring blood sugar or for measuring bilirubin and prevent jaundice. And I hope that we can keep doing it, and we can keep learning from each other and implementing what we have discussed. Sometimes it takes really small steps to save a lot of lives, and prevention is one of the things that I want you to focus on.
Dorothea Kongo. I work for Busoga Health Forum as a research and advocacy manager, and I coordinate Shall Thrive Project. It's a project supported by the Swedish International Center for Democracy, Local Democracy. It's a 3-year project that aims at improving the quality of care for children within Busoga region. And this project has 4 small projects under it. That has the emergency care project, which aims at improving the emergency care for children within Busoga region. And we have the meets in the regional referral. Is acting as the hub, and lower health facilities at the school. We are starting it here, then we shall scale it down to the lower health facilities. And so I talked of emergency care as one of the small projects. Then we have also neonatology, which aims at improving the care for the neonates. That includes the infection prevention. And then child's rights is looking at improving the child-focused healthcare within the region. But this will be also scaled out to the whole country, because we want to look at a healthcare facility where children look at it as their facility, the welcoming images, the play areas, where we want to see that children are involved in their healthcare. And then the neurology, we want to increase the awareness and awareness of the neuro diseases among children within Busoga region. We want to create awareness among the communities and the health workers.
My name is Moses Changwa. I'm the CEO of Busoga Health Forum. As a forum, we are extremely happy about this partnership that is between PHI, which is the Pediatric Health Initiative, and the Busoga Health Forum. This partnership is mainly looking at improving the capacity of health workers in the Busoga region so that they are able to manage our children. You know, Busoga is known for a big problem of high mortality, high mobility in children, but this participation in this collaboration is bringing very good results, and we are hopeful that the management of our children is going to be very, very highly managed. I mean, it's going to be very important, and this is what the partnership is contributing to.
Please sit. Yeah. Oh, you look beautiful. Oh, yeah, without energy. Yeah, then we have to come to. Yeah. So warm. In our it's a little bit warm, but not like this. Yes, yes. I like it when you put it like that. It sounds great.